Welcome back. Dr. Ravi Patel with the Comprehensive Blood and Cancer Center is joining us now with our monthly cancer update. We have some questions here that were posed to CBCC by some of your patients, right?
Yes.
First of all, Merry Christmas and Happy New Year to you.
Thank you. Same to all of you and the viewers, of course.
All right. The first question is, are there any treatment options for elderly patients who cannot undergo surgery for cancer? Good question.
Yeah, that's an important question, and elderly patients do not need to give up, because nowadays, even if you can't have surgery done, modern therapy, for example, stereotactic radiosurgery is a good example. It can treat tumors in the brain, the lung, prostate, without surgical intervention. So if you have somebody who's 85, 80, who has a really aggressive tumor, you can give what is called a very targeted, intense radiation locally to the tumor and achieve equally good results as surgery.
A procedure normally covered by insurance?
Procedure covered by insurance. We have what is called the CyberKnife. It does that, and it's comparable to surgery. Now, that's not recommended for people who are young and active like you, where, you know, surgery would be a good way.
Here's a good question, because a diagnosis for cancer is a very stressful time for any family and for the person, of course, who's been diagnosed. Is there, does stress have any relationship with the treatment of cancer and the recovery process?
Very much so. In the past, it was very vague to measure that, because stress is a very subjective thing. Something which stresses you may not stress me out, or vice versa. But now what people can do is they can measure molecular blood tests which accurately can detect the level of stress you have. And recent studies have shown that not only relieving stress makes you more healthy, but in cancer it can prolong your survival. So you really need to figure out ways and means to do that.
That's what I was going to follow up with, and we have time just for maybe a follow-up question here. How do you relieve the stress? I mean, does this take some counseling? Does it take some peer counseling to talk to other people who have been diagnosed and gone through the process?
Simple mind-body techniques such as breathing exercises, relaxation techniques, psychological counseling. Just about 4 months of that, twice a week, showed a tremendous difference.
Okay, I guess we have time for one more question. Is there a danger to radiation exposure while undergoing CT scans for detecting early lung cancer?
No, this is a big thing, but it is not, because the new ways of detecting lung cancer is through what is called low-dose CT scanning. So the CT scan doesn't give you that much exposure and gives better results than a chest X-ray.
All right, good questions, good information. Dr. Ravi Patel with CBCC. Always a pleasure to see you, sir.
Same here.
We're back right after this.
For the 10th year in a row, the Comprehensive Blood and Cancer Center hosted a New Year's Day feast for hundreds of needy residents in our community.
Christmas is done. All of a sudden, New Year's, there's nothing going on. People have partied in the evening on the 31st, and January 1st is a very quiet day. So what we felt is that that would be a perfect day to start the new year with those who need something and do something for them on that particular day.
Residents of the Bakersfield Rescue Mission, the Bethany Homeless Center, and St. Vincent de Paul, as well as Bark and Tabitha House, were all treated to a hot meal today. They also received gifts like sweatshirts, blankets, and mittens. All right, looks like a lot of fun. Still ahead here on 17 News at 11. 23 ABC.
All right, Kim, thank you. Another New Year's tradition in downtown Bakersfield, the annual New Year's Day meal for those less fortunate in the community. This was the 10th year that the Comprehensive Blood and Cancer Center has hosted the holiday feast for residents at the Bakersfield Rescue Mission, the Bethany Homeless Center, St. Vincent de Paul, Bark, and Tabitha House. CBCC staff came up with the New Year's meal idea a number of years ago, since so much is already done during the holidays of Thanksgiving and Christmas, and sometimes New Year's was overlooked as a time to give back.
It's not that they forget people on New Year's Day, but mostly people have done a lot of things at Christmas time, and New Year's Day, there's very little being done. Everybody has been busy on New Year's Eve and New Year's Day. You want to get together and do something for those who are underprivileged.
In addition to the warm meal, those who attended also received sweaters, blankets, and mittens for the winter. Mercy Hospital downtown has announced